Hello, I'm Nigel, a senior optometrist at Specsavers. We've seen some questions relating to contact lenses and coronavirus, and we'd like to provide some advice on that. There is a lot of misinformation around contact lenses and coronavirus, and I would like to reassure you that wearing contact lenses is safe. However, before putting your lenses in, before taking your lenses out, it is very important that you wash your hands thoroughly with soap and hot water, and ideally you would dry them with a clean paper towel. We would always advise you to wash your hands using soap and water. However, if that option is not available, then you could use a hand sanitizer. The concerns with hand sanitizer is that most of them contain alcohol, and if you get that alcohol onto your contact lens and put it into your eye, it's going to sting. Okay? So you need to make sure either that all of the hand sanitizer is rubbed in thoroughly, or you might even need to clean your finger with a clean dry cloth before putting the lens in. Irrespective of whether you're wearing monthly or daily disposable contact lenses, you're normally still putting them in and out once a day. So in terms of how often you're touching your face, there isn't really any difference. I think what's important is that before you handle any contact lens, you wash your hands thoroughly first of all. If you are wearing monthly lenses which are required to be stored overnight, just make sure that you're doing exactly what your optician told you to do in terms of storing and disinfecting those lenses. We advise that you replace your contact lens case at least every month, and in the morning when you put your lenses in, what you should do is first of all discard any solution in the case, make sure it's completely empty, rinse it out with some fresh solution, and then just turn it over and leave it upside down to air dry on a piece of clean tissue paper. As long as you're washing your hands thoroughly, there's no need to wear surgical gloves when you're putting in your contact lenses. If anything, putting in a pair of contact lenses with surgical gloves on could be quite tricky. If you've been advised to use comfort drops either because you suffer from dry eyes or because just to make your lenses more comfortable, then the advice would be that you should continue to use them. If you stop using them, chances are your eyes are going to feel less comfortable and you're probably going to rub them more than you would have done anyway. However, before you put those comfort drops in, it is important that you do wash your hands thoroughly just to reduce the risk of any infection. If you're not sure about the best way to look after your contact lenses, then there is information on our website, or you can just speak to your optician.